Hello, this is Robin at VetComp and Penn. I'm going to shoot a short video about the VA disability claim of headaches. Veterans in some studies suffer headaches up to 4 times more than the general population. It's very unfortunate that veterans suffer headaches so frequently. It's actually one of the top 10 VA disability claims by VA reports. So there are many different types of headaches: cluster headaches, sinus headaches, tension headaches, migraines. There are headaches caused by chronic neck problems, neck pain that can cause headaches. So we see veterans treated for headaches very frequently on active duty because acute headaches can be caused by heat exhaustion, dehydration, viral illnesses. It's very common for there to be evidence of acute treatment for an acute headache condition in service. It's uncommon for a veteran to have evidence of a chronic headache condition on active duty, but it does happen. If you suffer a chronic headache condition on active duty and you receive treatment or a diagnosis, you may be service-connected for a headache condition on a direct basis. However, if you're service-connected for a disability that causes or aggravates a chronic headache condition, you may be service-connected or be eligible for service connection for headaches on a secondary basis. Let's talk about some of the primary disabilities that can cause a secondary headache condition. Sleep apnea, especially if you suffer chronic headaches in the morning. Sleep apnea can cause chronic morning headaches. TMJ, believe it or not, can cause headaches. Chronic neck problems can lead, if you're service connected for your cervical spine and you develop chronic pain in your neck, that can frequently lead to headache pain. Another thing is a traumatic brain injury, unfortunately, which is very common among veterans. Up to 20% of people who suffer a traumatic brain injury can have chronic headache condition afterwards. PTSD, another unfortunate common mental health condition that veterans suffer from. They say up to 35 to 40% in some research of veterans who suffer PTSD have chronic headaches. Other mental health conditions, depression, anxiety, chronic pain, conditions can cause headaches. There are many different service-connected disabilities that can lead to chronic headache conditions, and we see many veterans who are eligible for a chronic headache condition on a secondary basis. If you're going to put in a claim for a chronic headache condition on a secondary basis, you must send supportive medical evidence, a medical diagnosis. If you have treatment with prescriptions, you should send in your prescription medication evidence. You should also send a log in how frequently you suffer your headaches. Always write it down. Headaches, the word headache is not in the 38 CFR. You will find migraine in the 38 CFR. The schedule of ratings will show you the different diagnostic schedule for rating headaches. All headaches, no matter what they are rated under the diagnostic code for migraines. They say, doesn't matter what type of symptoms that you have, that doesn't affect your rating at all. What matters is how frequently you have what they call a prostrating attack. Prostrating is not defined in the 38 CFR. Prostrating means to lie down. A prostrating headache is a headache that puts you out of commission. You can't go about your daily activities for at least 2 hours. Whether, you can't go shopping, you have to leave work early, you have to just sit and lie quietly. Whatever it is, prostrating attack is generally something that puts you out of commission for at least 2 hours because of your headache. If you have prostrating headaches on average once every 2 months, that's a 10% rating. If you have them on average every month, a prostrating headache attack, that's a 30% rating. If you have more frequent and more severe headaches than once a month, and if they affect your work negatively, then that's a 50% rating. To get the 50% rating and show that it affects your work, you would need a letter from your employer saying that you miss work frequently because of headaches, have to go home early, whatever the case may be, that you use your PTO or sick call all the time because of your headaches. Maybe you have FMLA protection because of your chronic medical condition. All of those things could equal the 50% rating for headaches. So that's a little bit about headaches as a VA disability claim. If you believe you have a headache condition secondary to a service-connected disability and you're having trouble winning that claim with the VA, give us a call. We may be able to help. We can help a lot of veterans with headache conditions at VetComp and Penn. I hope you give us a call. Thank you.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances in all cases.